vaccine distribution been going? Has it been fairly even, or have there been areas that are harder to reach? And if so, what have you been doing about that?
Well, from the beginning, we wanted to make sure that as we were getting vaccines out across the state, that we weren't leaving any part of the state behind. And so we've worked with our partners, from the very first vaccine that we've gotten, to make sure that we were distributing it equitably and that they were able to get folks in. And so we've seen situations, and in fact it happened, and I just told this story, it happened in Rapid City here, where, by the way, Monument's been a great partner. I mean, they have been awesome. And so the way this process works is, early on we had our phase 1 vaccinators. They were the ones getting the vaccine that we had available. And we would look at what we were getting, and we only know that a week in advance. So we know every Tuesday what we're getting the following week. And we talk with these guys, and we still do this every Tuesday afternoon, and talk through that. And then we overlay kind of how do we know how we're doing with the priority populations in terms of getting everybody in. And so it's a lot of dialogue, a lot of input from our partners. And I remember one week, and I just think this really speaks well of how our healthcare partners have done with this whole effort. And it was actually the Sioux Falls region that was behind. They had more people within that particular priority group needing to be vaccinated, and they were pretty caught up here in Rapid City. And the folks at Monument said, why don't you take some of the allocation you would have given us and direct it to Sioux Falls where they need it, so that we can kind of stay consistent. And I tell that story because I think it just speaks well of Monument, but also just the whole approach, which is we don't want to leave anybody behind, and we want to try to be as consistent as possible. So no matter where you live, you're getting access. So we're, now we're in a different spot where we have vaccine available to anybody 16 and older, which is awesome. Very pleased to be at this point. And we know we're going to have to circle back to folks who are hesitant for whatever reason. And so that will be work that we're starting to do and have been doing, and we'll have to really continue to do and really tease out some of those populations that they either needed more time, they needed more information, they need to hear the information maybe in a different way, and so that they feel comfortable becoming vaccinated. So we anticipate lots of activity in that realm, especially in the coming